Well, good evening. I'm pleased to be here tonight with some heroes in our community who every single day go out to keep us safe. Those heroes sometimes wear white coats, and sometimes those heroes wear the uniform of the Pennsylvania State Police. I'm pleased and relieved to be able to share with you that after an aviation accident this evening in Carlisle, two of those heroes, two Pennsylvania State troopers, Corporal Bryce Corman and Trooper Jason Mills, while injured, are going to be okay. I just spent some time with the corporal's family and with the trooper's family, and I expressed to them on behalf of all 13 million Pennsylvanians how thankful we are for their service every day and how our prayers were all answered that they are going to be okay and survive their injuries. They are members of the elite aviation unit with the Pennsylvania State Police, a unit that I'm very familiar with. These are people that move folks across this Commonwealth. They are people who lead important investigations, and they are people who are absolutely essential to the operations of the Pennsylvania State Police, and we're so grateful that they are going to be okay. We not only had the opportunity to spend time with their families, who are obviously relieved that they are okay, but I think what is important for you to also know is that lining the hallways here at this outstanding medical center were all the troopers and all the leadership of the aviation unit and many members of our state police family who rushed to this scene when they knew that one of their brothers, two of their brothers, were injured. That speaks to the family that is the Pennsylvania State Police, the love and respect they all have for one another, and as their governor, the appreciation and deep respect that I have for each and every one of them. Tonight could have been much worse. Tonight could have been much more tragic for our state police family. Thank God that it wasn't. One of the reasons for that is because of the outstanding medical care that they received here at Hershey. You're going to hear in a moment from Dr. Ludwig. She and her team did extraordinary work here, and we are thankful to them, to the doctors, to the nurses, to the medical staff who do this work every single day, but tonight they were called upon to do it for these wonderful members of the Pennsylvania State Police. So, Doc, we appreciate you very much. I also want to thank Dr. Michael Kupperman, the CEO here at Hershey. It says a lot about the leadership of Hershey that he came here this evening, that he wanted to be here to not just stand with the Pennsylvania State Police, and they support the state police every day, but to stand here and make sure that his team, his outstanding team, had everything they needed to be able to care for our troopers. And we are incredibly grateful for the leadership that you showed here. I'm thankful that we are joined tonight by the leadership of the State Troopers Association. Steve Polishin, who joins us, represents the women and men of the Pennsylvania State Police. And we thank you, Steve, for rushing here to the scene. And I'm most especially thankful for the strong leadership of Colonel George Bivens, leads the Pennsylvania State Police every day. He is someone who is without peer. He is someone who feels in his heart and in his gut the pain that these troopers are feeling right now in their bodies. And he is someone who has earned my deep respect and leads the Pennsylvania State Police just in an outstanding way. He's going to provide some additional facts on what happened in Carlisle this evening. It is obviously a fluid situation and an ongoing investigation, so he'll be limited in his comments. Then you'll hear from Dr. Ludwig on behalf of Hershey Medical, and then I'll come back up and we'll do our best to answer your questions. Colonel Bivens.
Thank you, Governor. Good evening. I want to stress that the information that I'm going to provide is very preliminary, as there will be a very detailed investigation conducted. But what we do know at this point is that at about 6:30 p.m. this evening, one of our helicopter crews based out of Harrisburg was down at the Carlisle Regional Airport conducting routine training exercises. At about 6:52 p.m., they were hovering several feet off of the ground, not on the runway, on a grass area adjacent to a runway. A small Cessna Model 150, which is a two-seat, typically used as a trainer aircraft, approached from behind, lined up with one of the runways near that grass area. As that Cessna came down along that runway, for an unknown reason, it veered hard to the right at the last moment. It struck the helicopter from the rear. The pilots would not have been able to even see that airplane approaching them. It hit the rear tail rotor and went into the main rotor of the helicopter, resulting in a very violent crash. The plane crashed into the ground a short distance ahead in many pieces. The helicopter, without its blades and without its tail boom, rolled inverted and crashed into the ground on its side and partially over onto its roof. Both pilots were initially, from the helicopter, were initially trapped inside the helicopter. The corporal was in a position to push out a window and assist the trooper who he believed had some more serious injuries and had a lot of bleeding, was able to assist him out through that window and got both of them out of the helicopter. There was certainly a lot of concern that there could be a fire or other hazard because of the violent nature of the crash. Within a very short period of time, others who had been at the airport arrived on scene, provided assistance. The one known occupant of the Cessna 150 did not survive the crash. We're not prepared to release information on that individual yet, pending notification of next of kin. And there is a lot of investigation to be done there. The FAA and NTSB will head up that investigation, supported by the Pennsylvania State Police. We have secured the scene, and as of about 35 or 40 minutes ago, the FAA did arrive on scene. The NTSB is expected sometime overnight. As I said, we've secured that scene, and we're prepared to provide evidence that we had already gathered. There is some video and photographs that are available that will be able to be used to reconstruct what occurred. At this point, I'll turn it over to Dr. Ludwig to talk a little bit about the care and the status of our pilots since their arrival here at Hershey Med. So, Dr. Ludwig?
Hi, I'm Dr. Ashley Ludwig. I'm the Trauma Medical Director here at Hershey Medical Center. This evening, we received 2 patients that came in as level 1 trauma activations, and both of them, thankfully, came out with just minor injuries and are stable. I'd like to thank our pre-hospital colleagues, as well as my trauma team and all of the team that goes into taking care of these patients. And we're very grateful that our colleagues with the Pennsylvania State Police are doing as well as they are.
Thank you, Dr. Ludwig. I would just note a couple more things here. You know, cops are tough, and they don't always take direction very well. But when Dr. Ludwig told them to do something, they did exactly what she said. It speaks to the respect they have for the wonderful doctors here at Penn State Health. And we're really incredibly thankful to you and your team. I neglected to mention one other important piece of information. The Colonel touched on this with the FAA being on the scene. I want to say special thanks to Secretary Sean Duffy of the U.S. Department of Transportation. We communicated within the last hour. We asked them if they could expedite the presence of the FAA on the ground. And Secretary Duffy was outstanding in meeting that request and making sure that the FAA was here to begin this investigation immediately. So I do want to thank Secretary Duffy and the Trump administration for their support of our community in this really difficult time. With that, the doctor, Colonel, and I will be happy to do our best to answer any questions you have.
Do we know if there was any communication between air traffic controllers and the plane at all, or if that's part of the investigation, anything there that you're able to share?
That will be a part of the investigation. I do know that there is not a control tower there, but there is a common traffic radio frequency that is used by traffic there, and that there was some communication on that frequency. We'll have to, as part of the investigation, sort all of that out.
The other pilot that is deceased, do we know at least if he's local or she is local?
We do know something about that pilot. The plane was based here. I really am not prepared to say anything more about the pilot, pending the notification.
Were there any other passengers in the Cessna or just the pilot?
Again, part of the investigation, we'll look into that. At this point, we believe only the pilot. When I say it was a very violent crash, that plane was cut into a lot of pieces, and so, again, a part of the investigation will be ensuring that there was what we believe one occupant.
Last question.
Governor Shapiro, you mentioned that although this crash was tragic, it could have been a lot worse. Could you sort of speak to the importance of all the different gears of this machine working together?
Thousands of brave women and men put on the uniform of the state police every day, and they leave their homes and they go out to keep us safe. Sometimes they go out and they get in their patrol car. Sometimes they go out and they get in a helicopter. These two gentlemen got in a helicopter, and they were conducting exercises that worked to benefit our safety, the safety of the people of Pennsylvania. And the moment tragedy struck, the Pennsylvania State Police mobilized, Dr. Ludwig mobilized, the other EMS personnel mobilized, and ensured that our troopers were able to get here to Penn State Health to get outstanding care in really what I would say was an extraordinarily short period of time. I'm not a physician, but I think I can say this, Dr. Ludwig, and you'll agree that because of the short amount of time it took to get them here, because all of the gears were working together, that left our state police members better off from a health perspective. And so this is an example of Pennsylvania at its finest, neighbor looking out for neighbor. And in a time when you had the state police who look out for us every day in need, the health community, healthcare community stepped up to help them when they were in need. That's a righteous cycle, and it is one that I hope the public appreciates. Some days the medical personnel here aren't treating police officers, but they're treating our neighbors and doing it in a way that helps them get home to their loved ones at night. A lot of days the state police go out in those gray uniforms of theirs and do things that we don't see every day, but make us better off. That's a righteous cycle in our world, and it's something that we ought to celebrate. We ought to treat our police with respect, and certainly we ought to lift up our healthcare professionals and give them the kudos that they deserve every day.
Thank you, sir.
Dr. Ludwig, this might be a question for you. You mentioned they are in stable condition. Do you have any updates in terms of their recovery or when they're expected to be released from the hospital?
I have one of them is actually in the process of possibly being discharged this evening, and one is being admitted for observation.
Were they transported by air, ground?
By aircraft.
I want to thank you all. I know it's a late night, and look, we appreciate you all being here. And I know these are challenging events to cover because there's not a lot of information we can always share. and we can't always share it on the timetable that you'd like. And so we appreciate the sensitivity within which you do your jobs to report the information to the public. So I want to thank you all for being here on a late night and doing the jobs that you do in the professional manner that you do them in. Thank you. Good night.